Welcome to Universal Education Foundation. This is one of, I'd say, about 4 or 5 mosques in Fort Wayne. We are both a mosque and a Sunday school. So we have from first grade up until high school, each Sunday, you see all these rooms are classrooms. We have Arabic, Quran, and Islamic studies for kids every Sunday from about 11 to 2 in the afternoon. It's all volunteer-based, and a lot of the students are on free tuition or scholarship through the community. My name is Ahmed Abdelmageed. I'm an associate professor of pharmacy here at Manchester College of Pharmacy. I'm also an associate director of experiential education, and what that means, I set up the curriculum for and the affiliation agreements for our students to go out in the real world and practice pharmacy. So whether it's your neighborhood CVS, Walgreens, Independent, or hospital, or Matthew 25, thank you for Matthew 25 for being here, and other places our students go and learn pharmacy practice. Tonight is a much bigger class than usual. Professor Kessler's transcultural class is here from IPFW. Thank you all for being here. I've been doing this with Professor Kessler for at least 2 years, I'd say. And just because she's sick of looking at the same slides, I decided to turn it into a Prezi today. So this will be my first time doing this. Bear with me with any technical difficulties, but I'd like to also welcome Huntington University, the new PT school OT school that started in Fort Wayne, up at the Rendalia Parkview campus in that area. So hopefully afterwards you guys get to know each other, get to meet each other. Both Dr. Ford and I work on an interprofessional education committee where we have medical students who I believe we're expecting about 5 of them here today. Do we have any of the medical students here with us today? Thank you all for being here as well from IU School of Medicine here in Fort Wayne. So the intention behind this is to have it in as interprofessional as we can. We also have clergy from Universalist Church as well.
I'm not clergy.
I'm sorry. She's not clergy.
I'm representing Unitarian Universalist Church.
She's representing Universalist Congregational Church. I'm trying to get all the churches in Fort Wayne down. But there's a whole long list that I apologize if I mess up the name. So anyways, welcome to all of you for being here. Today's conversation is about Islamic caring for the Muslim patient. But obviously, as you can see by my credentials, I'm a doctor of pharmacy. I am not a theologian, nor did I study the religion of Islam in a scholarly way. I don't have a degree in Islamic studies. The one who does is the imam or the pastor or the leader of this mosque, and he will be joining us for the question and answer session. I am, however, someone who was born and raised in a predominantly Muslim country. I am Palestinian, but I was born and raised in Qatar. And I grew up in a predominantly Muslim country. There were other faiths, but if you throw a stone, chances are you're going to hit a Muslim. That's predominantly Muslim country means. I grew up in mosques, I grew up with the religion, but I really truly did not understand my faith until I moved here. And the reason why is I went through what sociologists dubbed the classical culture shock. I went through questioning my faith, trying to understand why I practice the way I practice, why I believe what I believe in. And that challenge to my core beliefs helped me understand my religion rather than just regurgitate what I see other people do. Okay? And with that, combining it with healthcare, please come in and have a seat. Don't worry about it. We're very informal here. And by the way, stop me at any time and ask questions. So being challenged and trying to understand what I believe in, combining that with healthcare has led me to this presentation, which is, you know, in healthcare, we're going to touch people from all walks of life, from all different faith practices, from all different countries, and what we care about is providing the optimal care to our patients. That's why we're called health care. So I'm interested in the care aspect of our healthcare profession. And I also want to welcome Dr. Spister, the medical director of Matthew 25. Thank you for being here. Okay, having said all that, the objectives for this evening, whoops, I told you, bear with me. All right, here we go. So we're going to list the 5 pillars of Islam, and this will be actually the majority of our conversation today. And hopefully I'll get to that before we have to break for the evening prayer, and I'll explain all of that. Then we're going to go into discussing modesty and gender interaction considerations when caring for a Muslim patient. And we'll talk about dietary restrictions for a Muslim patient, and discuss maternity, labor and delivery, and end-of-life issues as they pertain to the Islamic faith. So obviously, we're going to hit a lot of topics, and we're going to hit the major points of those topics, and hopefully give you somewhat of an understanding about Islamic practice and the Muslim faith. All right, so what is Islam? The essence and substance of Islam can be easily summed up in 3 stages, if we're thinking about it spiritually. There is Islam, which means submission to God's will. Iman, which means faith in God. And Ihsan, which means virtue through constant regard to and awareness of God. If you manifest those spiritual stages into physical activity, then we come to the 5 pillars of Islam, which are the testimony of faith, prayer, paying of zakah or alms, fasting the month of Ramadan, and Hajj or pilgrimage to Mecca. And we'll go through each one of these pillars and we'll explain them in more detail, because it's really where the application into the day-to-day activities or lives of a Muslim, you'll see those more, and it will make a lot more sense if you understand the foundation upon which the religion is built. Okay, so who are the Muslims? And we're going to start with a pop quiz, and in case you can read really well, I'm going to blur this up. List the 3 countries with the largest number of Muslims in the world. Off the top of your head, throw it out there. And Pakistan, 1. Israel. I'm sorry? US. We're getting there, but we're really not high up there.
Libya.
Indonesia. Libya. Saudi Arabia. Very good. You guys comfortable with those answers? All right. Let's look at that. The top 3 countries with the largest number of Muslims in the world are Indonesia, with 205 million Muslims, Pakistan, about 178, and India, about 178 million. These are the top 10 countries with largest numbers of Muslims in 2010. And really, if you look at it, Egypt, Algeria, and Morocco are the only Arabic-speaking countries that made the top 10 list. Saudi Arabia is not even on there. And the reason I bring this up is that there's a very common misconception that every Arab is a Muslim and every Muslim is an Arab. Okay? That's not the case. Obviously, Indonesia, Pakistan, and India are non-Arabic speaking countries, but they compose the largest portion of Muslims in the world. If we look at the regions of the world, 62% of the Muslims come from Asia Pacific. Okay? About 20% from the Middle East and Northern Africa, so your Egypt, Libya, Morocco, Algeria. Those are lumped with the Middle East. And North Africa, about 20%. The Americas, between North and South America, we're at about 0.3%. Okay? If we look closer at home and look at the United States, there aren't a lot of studies out there, but one really good study that I found measured the number of congregants or the adherents or people that come to a mosque to pray, and the darker it is means that you have a higher concentrations of Muslims in that region. So when you look at the Midwest, Michigan really, northeastern Indiana, in Illinois, northeastern Illinois, we have a big high concentration of Muslims. We look at the Midwest, and we look specifically at Indiana. Well, it's supposed to say Muslim right here. We look in Indiana, there's about less than 0.5% of the population of Indiana are Muslims or adherents to the Islamic faith. What is the population of Indiana? Anybody knows off the top of their head? 6.5 million. So 0.5 of 6.5 million is a really small number. I can't do that math in my head. What is the most striking number on this chart for you? Oh, scientists of the future who look at details. Oh, sorry, I guess you can't. I guess that's not fair if you don't need, if you can't read the categories. All right, fine, you caught me. We'll revisit bonus question. Okay. Here, you can read the categories. What's the most striking number on there? Margin of error, plus or minus 4%. So I could be a figment of your imagination. I don't exist. Or could be a lot more than 0.5% Muslims in Indiana. I serve on the board of the Muslim Alliance of Indiana, which is a statewide board, and the board of this mosque, and I can tell you that 0.5% is a much lower representation of the number of Muslims in the whole of Indiana. The Pew Foundation, the Pew Research, attributed such a large margin of error to post-September 11, a lot of Muslims shied away or were afraid to indicate their faith on the census papers, just for fear of retaliation or fear of association with Al-Qaeda and other terrorist groups that done all the horrible things that we hear about in the news. But I'd say in Fort Wayne alone, anecdotally speaking, we're about 3,000 to 5,000 Muslims, majority Burmese. Then Northern African, we have a high concentration of Sudanese and Chadian. And then Asia Pacific, we're looking at Pakistani, Indian, and then Arab is a very small minority within the Muslim population in Fort Wayne specifically, or in Allen County. Okay. So, who are the Muslims? As we can see from all these statistics, I can't give you a certain feature or a certain look and say this is what a Muslim looks like or this is who a Muslim is. Muslims come from all walks of life. They represent all different kinds of cultural backgrounds, societal backgrounds, traditional backgrounds, and they're all combined, as this picture shows, they all make up the picture of Muslims in the world. So, within all of that diversity of Muslims, from Pakistani, Burmese, Arab, Palestinian, whatever, there is a unity within all that diversity. And we do not, like Christianity, have a clergy. So I guess everybody knows the Vatican. We don't have a Vatican in Islam. We don't have one temporal or spiritual governing institute that governs the entirety of Muslims or Islam in North America. Rather, what we have is what's dubbed the traditional canon. And the traditional canon is a collection of sacred texts which everyone has agreed, everyone meaning the scholars of Islam, the ones with PhDs in Islamic jurisprudence, Islamic studies, Quranic exegesis, and all of that. They've agreed that those are authoritative and definitive and fix the principles of belief, practice, law, theology, and doctrine through the ages. And there are three terms up there that we'll talk about: Quran, Hadith, and Sunnah. Okay, Quran is the Muslim's Bible. It's the Torah, it's the Old Testament. It's basically, to the Muslim, the exact and absolute word of God. Okay? So Quran was revealed to Prophet Muhammad when Prophet Muhammad was 40 years of age, and he used to contemplate or meditate in a cave in Saudi Arabia, and Angel Gabriel came to him with the first verses or first revelation of the Quran, which were Iqra, or read. And that first revelation started 23 years of revelations from God through Angel Gabriel to Prophet Muhammad, composing what is our sacred text called the Quran. Okay. So for the Muslims, the Quran is absolute. It's the word of God. It hasn't changed ever since Muhammad was sent with the message over 1400 years ago. Then there's Hadith. Hadith means the spoken word of the Prophet. So what the Prophet has said was documented, okay? And that documentation is collected in books, vetted and verified as much as you can verify with the chance of human error involved with it, okay? So it's not absolute, but it's very close to the truth, especially if, when you look at books like Bukhari, for example, who's one of the biggest names in hadith collections or spoken words of the Prophet's collection. he has a chain of narration that goes back to the Prophet. This person said that this person has said that this person has said, and they have a whole method of verifying and authenticating that to say that this is what the Prophet has said. So it's, if in a hierarchical sense, Quran is the top, you don't argue that it is an absolute. But then Hadith is more supportive. It comes after that. It holds the chance of error. Sunnah is that the way the Prophet lived his life, the way he practiced, the way he ate, the way he spoke, the way he interacted with people, that was as well documented. So his spoken word and his actions were documented because he is the exemplar Muslim. Okay? For anyone that wants to understand Islam, we look at the Prophet Muhammad and how he lived his life, and he was the best example for us to emulate and for us to follow and for us to understand our religion through him. Okay? So the scholars of Islam, which again, you have some heavy hitters in Islamic education. For example, there's Azhar University in Egypt, or there's the Medina Institute in Saudi Arabia, or there's Deoband School in India. And those are the ones that issue you your degrees in Islamic studies. And there are many different levels. We said, you know, there's Islamic jurisprudence, there is exegesis, which is the interpretation of the Quran, there is Hadith interpretation, there is Sunnah science, and all of that. So they issue those degrees to the Muslim scholars, and these Muslim scholars interpret the texts and work out their practical applications and detail certain limits beyond which it will not go. If you want an example to think about, it's like the Constitution. We have certain black or white inalienable rights that no one can argue, but then there's areas in the gray. And someone has to be able to interpret the gray area to interpret it in a cultural sense, in a societal sense, in the time that we're living in sense, and how to draw practical applications from it to issues that might come up in modern day. Okay? An example of that is smoking or cigarettes. There isn't a verse in the Quran that says smoking is a sin. There's nothing that says in the Quran smoking or using tobacco products is a sin or is harmful or you should do it. Nothing in there. Okay? So people looked at, the scholars looked at then Hadith. They looked at the spoken word of the Prophet. Did the Prophet ever say, do not smoke? Did he say, do not chew tobacco? Did he mention anything about tobacco? And I don't think in Arabia at that time, tobacco was even a known product. They couldn't find anything. So then they went to the life of the Prophet. Did he ever tell someone, do not smoke, or mention tobacco or anything like that? There was nothing. So the question came up with cigarettes and tobacco use and cigarette smoking to the scholars of Islam and said, is it allowed for a Muslim to smoke or not? Is it harm? I mean, we obviously know the harms of it. We know everything about smoking nowadays. So is it considered a sin? Should a Muslim smoke or not? So when they went through, again, the Quran, Hadith, and Sunnah, and there was no explicit text about it in there, they went to analogy. They looked at the Quran. There are verses in the Quran that says, and do not throw yourselves into harm's way. It's a general. Do not throw yourselves into harm's way. They looked at the spoken words of the Prophet, and there are different hadiths or things that he said that support that argument, that as a Muslim, sanctity of life or preservation of your health and your body is important, and you should maintain it. So they looked at that as a support to the verse in the Quran that says, do not throw yourselves into harm's way. They looked at the way that the Prophet lived his life. He ate modestly or moderately. He exercised. He took care of himself. He took care of his health. So looking at all these three things together, the scholars of Islam said, we will issue a fatwa. You've heard that word before. But we'll issue a fatwa or a religious edict saying that smoking is haram, or smoking is a sin. That a Muslim should not do that. Majority of the scholars said that. Some scholars said, I won't go into absolutely prohibiting something that was not explicitly prohibited in the religion. I'll go to say as far as it's really frowned upon, you really shouldn't be doing it, but I'm not going to, put the words sinful next to it because it's not explicitly stated. So for practical applications of issues that are not explicitly stated in the Quran, the Hadith, or Sunnah, we look at what the scholars have said. And then for the Muslim, you look at the various opinions. So for majority of the Muslims, they look at majority of the scholars said this way, so we'll follow the majority of the scholars. Some say, I don't really believe that fully, but I found a couple of scholars that have interpreted in this different light, and I find that more appealing to my heart or my mind. I understand that better, so they follow that. Again, these are things with the gray area and practical applications to things that are not explicitly stated in the religion. And with that comes some variability. So there's cultural influence, there's societal influence, there's the country of origin or where you've come from or what a predominant school of thought within the religion of Islam was, where you came from. That will influence your application to certain things within the religion. And we'll have a couple of more examples that clarify that as we move forward. We doing okay so far? Any questions or concerns? Anybody sleeping on me? All right. So from that, we move into the 5 pillars of Islam. And we've mentioned them, but we'll look at them in more detail. The first pillar of Islam is the testimony of faith. Testimony of faith is, I bear witness that there is no God but God, and that Muhammad is his messenger. So Islam is a monotheistic religion. We believe in one God and one God only, has no partner, no associates, no children, no partner. And that Muhammad is his messenger. Muhammad, again, we talked about him a little bit with the revelation, and the period of his prophethood was the last 23 years of his life. But Muhammad to us is the last and final messenger. If we dig deeper into the meaning of the testimony of faith, we look at the tenets of faith. One is belief in Allah. Allah means God. It's just the Arabic word. It's synonymous to the word God. If you open the Bible in Arabic or the Torah in Arabic, you will find the word Allah where God would be. So he's not a different deity or a different God to be worshipped. And when I say different, meaning within the Abrahamic religion sense, God is the same concept, and Allah means God. Allah actually, linguistically in the Arabic language, means the God, or the way it's written in Arabic linguistically, it cannot become plural. It's in the singular form, and you cannot pluralize the word Allah. So linguistically, it even denotes monotheism. We believe in the angels. So we believe in the unseen. We believe in angels. I mentioned Angel Gabriel, who revealed the Quran to Prophet Muhammad. We believe in angels, that an angel on your right shoulder who's writing your good deeds that you do throughout your life, an angel on your left shoulder who's writing your bad deeds that you commit throughout your life. And that will become a little more important why I mentioned those particular angels as we move down it. We believe in the Quran and the books. We've talked about the Quran, and Islamically it is the absolute word of God for us. But we also believe in the books that came before the Quran. So as a Muslim, for me to be a full Muslim, I have to believe in the Bible, I have to believe in the Torah, I have to believe in the Talmud and all the books that came from God to the prophets before the Prophet Muhammad. But in our faith, the belief is human intervention went into these books. They weren't preserved as the Quran was, and the Quran became comprehensive of the books before it. It came with the same message of knowing God, worshiping God, maybe in a little bit of a different way of showing that faith. But for me to be a full Muslim, I believe in the Bible, the Torah, but as they were sent to those prophets, not as they exist in current day, because you have different variations or different interpretations of those books. We believe in Muhammad and the messengers. Obviously, Muhammad to us is the last messenger, and we believe in the messengers that came before him. So I believe in Jesus. I believe in him as the son of Mary. I believe in the Immaculate Conception. I believe in Moses, David, Ezekiel, John, Jonas, all of the prophets, all the Abrahamic prophets that, if you're a Christian or a Jew, you have heard about in your books. we believe in them. But Muhammad, and the best way to describe it is a hadith that he said about himself. He said, the likeness of me to the prophets before me, or the likeness of the faith, likeness of me to the prophets before me is like a beautiful building that is built, but it's missing one little piece. And people walk around the building and say, what a beautiful structure, but it's missing this one last piece. He says, I am that last piece, I complete that beautiful structure, meaning faith, meaning believe in God, meaning that we're all integrated. But in our belief system, Muhammad was the last messenger. He's God's, again, in our belief, last messenger sent to humanity saying, here's a message that I promise to preserve until the end of times, comprehensive of the messages that came before it, and that's it. There's no, again, in our belief, there's no prophet that came or will come after Prophet Muhammad. We believe in destiny. Yes?
Do you believe that, does Islam, do they believe that Jesus is the Son of God?
No. The question is, do we believe that Jesus is the Son of God? No, we believe in God as a deity that has no partner, no children, no equal. We believe we believe in the Immaculate Conception in the sense that Jesus was born to Mary without a father. And that's not out of the realm of possibilities because we were created from nothingness. So for us, God says be and you are, or be and it will be. So with the concept of the birth of Jesus, to us it was more of God's spoken word to Mary and creating Jesus in her. But no deification of Jesus, Muhammad, Moses, or any of the prophets. They were all humans in the sense that they were sent with the message, and they, like all other humans, will have a limited time on this earth. Does that answer the question?
Yes.
Okay. We believe in destiny. So we believe that whatever I do has been destined or predestined for us. Now, that's a difficult concept to wrap our minds around. So let's try and break it down in hopefully an example that would explain it better. Believe in destiny in the sense that God has created me with free will, and God will throw the map of my life in front of me, but the decision at the end of the day is mine. Okay? So let's say in a healthcare example, I get diagnosed with cancer tomorrow. Okay? So as a faithful Muslim, or as a Muslim who, as a believing Muslim, in my mind, there's the question of why me should not come up, or does not come up, if, again, with a strong faith. Because to me, it's destiny. God has destined that I get stricken with cancer. Now, at the same time, I don't say, well, it's my destiny, throw my arms up in the air and say there's nothing I can do about it, I have cancer. No, it's a trial. Our lives are considered a trial. You're on this earth for a limited amount of time, and then the hereafter, which we'll talk about in a second, is your final abode. But whether you get into heaven or hell, and yes, we do believe in the concept of paradise and hell, depends on your actions through your life on this earth. Okay? So if I lived a good life, if I was a good person, good to my neighbors, good to my friends, good practicing, and all of that, hopefully heaven will be my abode. But in the sense of destiny, I don't question God's judgment. I don't question God's trial that He threw my way in that I got diagnosed with cancer. Rather, I say, what God has destined, He has willed, and what He has willed has happened, okay? Which is me being stricken with cancer. But God has also given me the means, doctors, nurses, physicians, scientists that have researched, that have come up with medications, and I am to utilize the means that are available for me to make myself better, okay? Because again, the overarching concept is preservation of life, preservation of sanctity of life. This body you were gifted to live in, and you to take care of it until the day you die. So I don't question why I got stricken with cancer. I don't question losing my money. I don't question it in the sense that why me, and fall into that sense, but fall into the sense of understanding that this is yet another trial or tribulation that God has put before me, and my reaction to it, how I interact with that, will be recorded by the angels that I talked about on your right, on your left, and the accumulation of my deeds, whether good or bad, will be put in a scale in the hereafter when I'm before God, and depending on which side of the scale tips, if my good deeds outweigh my bad, heaven is my abode, and if it's vice versa, then vice versa. Does that make sense? So eventually, there's a sense of individual accountability, that whatever I do in this life, whatever I commit from spoken words, from actions, from the way I live my life, I'm held accountable for, and I'm going to be judged by God on the day of judgment, and determined my final abode would be determined based on that. Does that make sense? We good with that concept? Okay. So that's all the explanation of there's no God but one God, and that Muhammad is his messenger. The second pillar of Islam is prayer. And this is where we get into more of the physical application of the tenets of faith that you'll get to see a little more in your practice. We pray 5 times a day. And speaking of that, we're about 10-15 minutes away from the prayer. So this is perfect timing. We pray 5 times a day. There's a prayer called Fajr, which is before the break of dawn. Dhuhr, around noon. Asr is afternoon or midday. Maghrib, which we're about to pray in about 10-15 minutes, is at around sunset. And Isha is at night. And then weekly, every Friday, we have what's called Jum'ah, or the gathering or congregational prayer, around the noontime every Friday. That's kind of like the equivalent of Sunday Mass. We have Friday Mass. We pray the Friday prayer every Friday. Nowadays it's at 2 o'clock in the afternoon. Next week with daylight saving, it'll be at 1 o'clock in the afternoon. But basically, all of these prayers can be performed either individually at home, or with your family in a group, or in a congregational prayer here at the mosque. The carpeted area that you see behind you is where we do our prayers. And during the Friday or Jumu'ah prayer, we pull out more carpets. We have about 300 people that pray in this area. Okay? The Jumu'ah prayer or congregational prayer, the imam or the priest would typically give about a half hour, 20 minutes, half hour speech relevant to faith and day-to-day issues or things or concerns. And then we pray together at the end. Before each prayer, there's the call to prayer, which we'll get to here in about a few minutes, and that's kind of the ringing of the church bells. This is denoting that the time to pray has come, and I'll translate before we get into that. But basically, you do the call to prayer to announce that the prayer time has come. Every individual, man or woman, who has reached the age of puberty and displayed a certain level of maturity is at that point what we call at the age of accountability. So you're held accountable for performing the prayers, for believing in the testimony of faith, and for doing the pillars of Islam that we'll finish talking about. So once you reach puberty and display some maturity level in decision making, okay, so that gets at the concept of you have to have your mental faculties and intellectual faculty with it. So a mentally ill person is excused from performing the prayer. But when you're at that age of accountability, then you are to pray the 5 daily prayers. And this is the one act that you cannot give up unless you are, again, incapacitated or mentally unable to do so. Actually, let me get to this point and then skip, and then I'll explain the whole prayer and concept of it. Before we pray as well, we have to wash up. There's something called wudu or ablution. You wash your hands, you wash your arm, your face, your head, your feet. Basically, cleanliness is next to godliness. There's the physical cleanliness of preparing yourself to praying. When you're prayer, you're in conversation with God. So you put on your nice clothes, you clean yourself up, and you stand in prayer. There's also a metaphorical sense to it. Some scholars have said that when you're washing your hands, you're washing sins that your hands might have committed. You're washing sins your arms might have committed, your feet might have walked you to, or you listened to, or you've thought about. And we do that with each prayer, before each prayer, as a preparation. And then when we pray, we will face Kaaba. Have you seen that black house on TV? We'll get to see a picture of it coming up soon. But Kaaba is a house in Mecca. It is the first, in our belief again, the first house of worship that's built on earth. The most talked about narration, or the approved narration, is that Abraham with his son Ishmael built that house for the worship of God on earth, and it was the first house of worship. So for us, when we pray, we face towards Mecca, towards the Kaaba. Anybody, anywhere in the world, face towards that when they're praying, as a commemoration of Abraham, as a honoring to the house. So the house itself, or the Kaaba, is not an object of worship, but it's a unifying factor for all Muslims, where we face the Kaaba as we pray. And then there's the motions of prayer, which you'll get to see: bowing, prostrating. And with each movement, there are certain prescribed things that you have to say to make the prayer correct. But then there's the added stuff that you can pray for on top of it. So we have to pray certain verses of the Quran in each movement. We have to glorify God in certain, like when bowing or prostrating. But beyond that, you can communicate with God in that way. So there's no intermediary. You don't need anybody to speak to God on your behalf. This is prayer. Outside of the 5 prescribed prayer, you can also, what we call supplication or dua. You can raise your hands and talk to God at any time, ask for anything. I've been asking for the past 3 years for my house in Maine to sell. So that's testing my patience. So that's how I react to that trial and tribulation. So I was in Maine before moving here, obviously, and my house hasn't sold yet. But that's aside from the point. So you can communicate with God. You can talk to God at any point, but those prescribed prayers have to be done by every Muslim who has reached the age of accountability. Now, you might say, well, what if you're performing surgery? That's going to take you 4 hours. That's going to go from, this prayer time into that prayer time. So in between the prayers is the window for prayer. So between the noon and after or midday prayer, those 4 hours, this is the window for me to perform my noon prayer. Let's say I'm stuck somewhere or I'm traveling and I can't make the noon prayer in time before the afternoon prayer comes in. Okay? In these situations, if it's too much out of the way, you can combine the prayers and you can shorten the prayer. So let's say I'm traveling, I'm going to visit my sister in Michigan. It's a 4-hour drive. It's not a big deal, but with daylight savings, if I leave by noon, I won't get to her house until the evening prayer. I might miss my afternoon prayer. There's one of two things. Either I stop at the side of the highway and rest stop and perform my prayer, or if it's freezing and it's snowing outside and all that, and I have that excuse to combine the prayer and shorten it. Okay? If I am physically incapable of doing the bowing and the prostration and the praying, then in that sense as well, you can mimic the prayer. Let's say I'm quadriplegic, but I can still move my neck. Then I can, move my neck into the different movements. Basically, as long as you have this working and functioning, you have to make your prayer. Okay? Now, how does this impact you as a healthcare provider? The whole concept of ablution. If someone is in your care, they're staying in the hospital room, they might, if they're physically capable, they'd want to walk to the bathroom and cleanse themselves before they're praying. You might see them in a corner praying, or you might see a family member in a corner praying, or if they're bedbound and they can't move, they might not answer you the first time you ask them a question because they're praying. Basically, if the heart monitor is working and they're alive, but they're not answering you, they might be in a stance of prayer. It takes a couple of minutes, they'll break out of it afterwards and talk to you. But having access to water to be able to get yourself ready for prayer, and then performing the actual prayer, you will get to see that if there's a Muslim person in your care. I'm going to have to stop here for a second, but before you make the adhan, I'm going to explain a couple of things. What we're about to hear is the call to prayer, Ahmed's going to make the calling to prayer. He'll say Allahu Akbar, which means God is greater, God is greater. Allahu Akbar, God is greater, God is greater. Meaning that God is greater than anything else that you're doing. It's time to let go of it and come pray. Obviously with the common sense, if I'm driving in the middle of the highway, I'm not going to let go of the steering wheel and go pray. But I'll stop at a rest stop or whatever. So, Allahu Akbar, Ashhadu an la ilaha illallah, that's our testimony of faith. I bear witness that there is no deity or there's no God but God. And repeat that for affirmation. And then, Ashhadu anna Muhammadan Rasulullah, I bear witness that Muhammad is the Prophet of God. Hayya ala salah, which means come to pray. Hayya ala salah, come to pray. Hayya ala al-falah, come to success. Falah or success, because the success of a Muslim person is by maintaining their connection with God and by maintaining their 5 daily prayers. And then Allahu Akbar, God is greater, God is greater, is reminding you of the concept that you really should be done with whatever you're doing, such as talking to other people, and come to pray. And then La ilaha illallah is sealing it altogether, saying that there's no God but God. What you're about to say, Imam Nuh just joined us. He will lead the prayer. We'll follow his lead. He will read out loud. We won't. We'll just be following and mimicking his motions. We'll pray basically to ourselves. We won't repeat loudly after him. Some women feel comfortable praying in the back. Others would feel more comfortable praying in a separate room. Again, just because of the whole bowing and prostration, all of that, and we have prayer space out here. We all faced Mecca. We all followed the Imam in his prayer. The way that he prayed, what he was reading out loud is the Quran. So the first section that he read was the Fatiha, or the opener of the Quran. That's prescribed in each movement when you're standing up. And then the other stuff was basically other verses of the Quran that he had memorized that he added on top of it. When we're bowing, we're saying, glory be to God the Most High. When we're prostrating, we're saying, glory be to God the Omnipotent. And in between, again, or when you're prostrating, especially for the Muslim, we say that the nearest you are to God is when you're in prostration. After you say, glory be to God the Omnipotent, you can add any other supplications or anything else that you want. So this is the way that the Prophet prayed, this is the way his companions prayed, and this is the way it was transcended to us through the ages of how to pray. Okay, where were we? We were about the when to pray, the timing of prayer, having to pray. So you'll see your sick patient, if they're capable, if they have their mental capabilities, wanting to perform that and complete that every day. The next pillar of Islam, or the third pillar of Islam, is zakah, or paying of alms. And we'll brush through the next two rather quickly because they don't have much of application in day-to-day life as far as you're concerned with your interaction with the person. But basically we have the concept of on the money that you do not use. Let's say I have in my savings account $10,000, okay? That's money that I don't touch for a whole year, okay? Or I own something that I'm not using. I don't use the money to pay bills. I don't use the money to, to put food on my table, whatever. It's money that is extra. And it's above a certain amount that is calculated, and I can't remember how it's calculated, but let's say above $4,000. Okay? That money that I have above that sum that I'm not using for 12 months, I have to pay a tax on it, basically. It's called zakah or alms. It's 2.5%. Okay, so it's 2.5% on the excess money that you have. 2.5% of $10,000 is, move it 4 zeros, $250, right? So $250 on a $10,000 is not a lot of money, but that money that each person pays goes into back into the community. And the community, Muslim or non-Muslim community, basically that money goes into a pot. If you see here, those black boxes right here are zakah collection boxes that you can dump your money into. We can use that money mainly to feed the needy and the hungry within the community. Okay, so it goes to the poor. Okay, above that is left up to you. Okay, a lot of people pay 5%, 10%. There's no obligation upon the Muslim except for that 2.5% that is on the excess money. Okay, so it's not an overtaxing system, but it's a system that has a pool of money that is available to the poor and needy in the community. Okay? The fourth pillar of Islam is the fast of the month of Ramadan. The Islamic calendar is a lunar calendar. Lunar calendar basically each year falls back about 2.5 weeks. I'm not a physicist, remember, I'm a pharmacist, so I don't know how to calculate the moon phases and motions and whatever, but each year you'll see the 9th month, which is the month of Ramadan, fall back about 2.5 weeks earlier than the year before. Okay, so we're moving closer and closer to the summer right now, where Ramadan will start. And in the month of Ramadan, we fast. And there's a spiritual and there's a physical fast. The physical fast is you do not eat. Once you're at the age of accountability that we talked about, you do not eat, you do not drink. If you're married, you do not consummate your marital rights. Basically, you don't have sex with your partner, with your spouse, during the daylights from sunrise to sunset. Okay? So you abstain from food, from water, you give up your physical needs to God, and you fast during that day. That's for 30 days or 29 days, depending on the life of the moon in that month. And you fast again from sunrise to sunset. That's the physical part of it. It's simpler in a sense. The spiritual part of it, this is what we call the spiritual rehab of the year, or your spiritual boot camp. This is the month where you are to look at yourself, inventory your deeds, inventory your actions, and take yourself to account to better yourself and improve yourself for the upcoming year. So if I'm someone that, that leave work earlier than I should, I'm on a clock, and I should leave at 5, but at 4:40 I asked my buddy at work, hey, clock me out at 5 o'clock. I'm lying. I'm not doing a behavior that is befitting of a Muslim. This is the month where, I should stop it anyways, but this is a month where you're focused more on your actions. You're looking at what you're doing, and I should stop that. I should be a better Muslim than that. Okay? So the spiritual aspect of it is holding yourself accountable for your actions, looking at your deeds, trying to find areas for improvement, to improve yourself from one year to the next. The question that you'll be faced with as a healthcare professional is that your patient is going to be thinking, should I fast or should I not fast? If you are capable of fasting and it's not going to negatively impact your health, you're supposed to fast. But if there's a chance for it to impact your health, someone obviously on a TPN cannot fast. Someone really generally, in general rule of thumb, if they're in a hospital, they're sick enough not to fast. Some of them might argue with you. In that case, send them to me or send them to the imam and we'll talk some sense into them. But they really should not be fasting because, again, remember, sanctity of life, preservation of good health is optimum for the Muslim, or important. So to fast or not to fast is based on the person's ability to fast. My wife was pregnant 2 Ramadans ago. My son now, my third child is 10 months old. When she was pregnant, she did not fast because fasting would put her and the baby at risk, and the doctor said it's better not to fast. So she did not fast. The year after that, she was breastfeeding. The doctor said, if you're fasting, then probably they won't get the nutrients that you need. You might dry up early. She's excused out of the fast, so she did not fast. So for every action within Islam, there is an excuse to take you out of it for the time period until that condition is lifted. She's not pregnant anymore, she gets back to fasting. Or if someone is sick, they can break their fast, and then when they're healthy, they can make up the fast. So the choice for my wife was either to make up the fast when she was, after delivering and all of that, or for us to pay, quote unquote, fine, which is to feed a person for every day that she broke her fast. So think in the US it's about $8 to feed a person a meal. 8 multiplied by 30, whatever, $240. We paid that, again, to the poor and needy within your locale. And that will expiate the sin of not fasting, or will lift that condition of fasting from her. Okay? So you might find some patients that struggle with that it's the month of Ramadan, they really want to fast, but if they're excused out of it, they do not have to or not obligated to do it. At the conclusion of the month of Ramadan is our celebration, what we call Eid. Eid is festival or celebration. Eid al-Fitr is the breaking of the fast, and that comes after the conclusion of the month of Ramadan for a few days. Eid al-Fitr is 4 days, and the other Eid, Eid al-Adha, which comes at the conclusion of Hajj or pilgrimage, which we'll talk about next, and that's a celebration of 3 days. The reason I mention that is when I worked in the hospital, and I worked in the hospital in little old Bangor, Maine. Anybody familiar with Bangor, Maine? You're familiar with Bangor, Maine? How many people live in Bangor, Maine? Yeah, about 30,000 people live in Bangor, Maine. If you look at statistically, I think 98.5% was the number of the population of Maine was white, Caucasian, Christian in faith, and about 1.5% was other. But the hospital that I worked at, during the Eid time, and during Hanukkah, and during Christmas, and all that, they had some celebratory messages on their windows. So imagine that, I was a pharmacist working there, not expecting to see anything, and I see Happy Eid, or Eid Mubarak, which is Blessed Eid, is a salutation you say to the person. So that to me, as someone that worked at the hospital, lifted my spirits up a little more. But think about your patient who is already in the hospital, which sucks, is already sick, which sucks, and then they're having to miss all the festivities because they're stuck in a room with strangers. Maybe family will come visit, but they're not able to go celebrate it. And the way we celebrate it, we go visit each other, we bring candy to each other. Good God Almighty, my kids get hyped up on so much sugar because every auntie and uncle is just shoving candy in their mouth. But it's a lot of fun. And that patient who's in your care is missing out on that. A simple acknowledgement of that, if they're a Muslim, and you say, hey, I heard today is Eid, or Happy Eid, or Eid Mubarak, or something, acknowledgement of that would lift their spirits up and would help them feel better about the situation. And then when their family's coming, they're reminded more of celebrating and the fact that they're being cared for. Okay? Eid al-Adha is, again, after the conclusion of the pilgrimage. This is, it's called the Eid of Sacrifice. And this is where every person who's financially capable would sacrifice an animal, and the meat of that animal would go to, again, the poor and needy within the community. This is commemorating Abraham's trial by God of sacrificing his son. In the Islamic faith, it's Ishmael. I believe in the Bible, it's Isaac. But the story in a nutshell is that Ishmael to Abraham was a son that came at a much older age. He was his most valued thing in life, and God wanted to test Abraham's faith and Ishmael's faith. So asked Abraham to sacrifice his son, and then was replaced with the ram when they both were about to commit the act. So we commemorate that in the sense that God has saved Ishmael, Abraham has passed the test, both of them have passed the test, and we celebrate the conclusion of Hajj with that, and again the meat goes to the poor and needy within the community. The fifth pillar, the last pillar of Islam is Hajj. Hajj or pilgrimage. This is the Kaaba, or the black house that I was telling you about. This is in Mecca. This is the house that was built by Abraham and his son Ishmael. Obviously not the exact same structure, with 1,400 years of decay and some wars and whatever. It was destroyed and rebuilt. But I believe one of the bases, I'm not oriented correctly, but one of the bases is the corner that was built, and one rock has the footprint of Abraham when he was standing on it building the actual Kaaba. So this is where we direct ourselves when we're praying. And if you're completely directionally challenged, as I am, there's an app for that. You can always find out where the Kaaba is when you want to pray. This is a picture from Hajj. You see the black houses right here? This whole entire thing around it is a mosque. Okay? You see these little white dots? These are human beings. This is about 2.5 million people is the capacity of the haram, of the space of this area. Last year was the time that I was finally able to do that, and I prayed a lot up here. Basically, Hajj is once in a lifetime, that you have to do it for every man or woman once in a lifetime, once you are physically and financially capable. The trip to Mecca to make the pilgrimage cost upwards of $8,500. So it's not cheap. So you have to be financially able and physically able to perform it. Finally, last year, I was at that point where I was able to do it. Unfortunately, I didn't have enough money to take the entire family, but then with a 6'3" and a pregnant wife, that was not the optimum time to go to Hajj. But I went myself to do it and experience it. It's about, it's a 3 weeks trip, but the actual pilgrimage is over 2 days, a little over 2 days. But I experienced it once, and once the kids are older, I'll take my wife and go back, so at least I have practiced it once and can visit it twice. It's such an experience. I'm not going to go through the rituals, but a lot of the rituals and a lot of the prayers that are in there are commemorating of the story of Abraham. And it's the way that we were taught by Prophet Muhammad and his companions and his messengers. Now, if we go full circle, if one completes the Hajj or pilgrimage once in their lifetime, again, when they're physically and financially capable, this is kind of like hitting the reset button. You wipe the slate clean. So that book on your left shoulder with the bad deeds, if you performed Hajj with the right intentions, and you'll see with the Islamic faith, intentions is highly emphasized, because I might look like I'm praying, but I'm thinking about something completely different, or I'm just doing it for show. I want to impress people. Look at me, I pray. But the intentions and what my sincerity behind it is in the hands of God. He knows how I feel. He knows what I think. He knows what I believe in. So my intention, if performed correctly, I have the chance, and I won't know that until I'm dead and I'm before my Lord, that my book of bad deeds has been wiped clean. I've hit the reset button. And that theme actually goes back to also the fasting of the month of Ramadan. If from Ramadan to Ramadan I fast the month correctly with the right intentions, and I do the good deeds that are in it, there's a lot of extra prayers at night. There's a lot of reading of the Quran. There's a lot of emphasis on the spiritual. And you still have to go through your day-to-day life without eating and drinking and all of that if you're capable. But it's amazing how much energy you don't have when you're not eating all day, and how much you become conservative of your energy, where you're not going to spend it on thinking of other people's ills or ill intentions and whatever, and you focus on yourself and bettering yourself. If from one Ramadan to the next I perform that correctly, I have a chance at wiping the slate clean. If I pay with the right intention, if I pay extra, this will weigh heavier in my scale. A wife of the Prophet used to actually put a little bit of perfume on the money as she's handing it to the poor people, because she said, I'm putting it in the hands of God. So I'm putting it with a nice touch to it, a nice smell to it. And God rewards you as He would want to reward you. For every good deed, there's maybe 10, it equals 10 good deeds at least. For every bad deed, it's just 1. So God's generosity outweighs God's punishment. The purpose is not to punish the human being, but rather to give him the opportunity to do good, and your good will be multiplied. And then the prayer, the same concept, whether from Friday to Friday or from one prayer to the next, if I perform it correctly with the right intentions and I do it correctly, these are chances for me to wipe my sins clean, or to clear my records. And then when you think about it, if I'm praying 5 times a day, I'm connecting with God 5 times a day, I'm reminded of the fact that I'm held accountable for my actions 5 times a day, that limits my potential for making mistakes, that hopefully will limit your potential for harming yourself or harming others, and keeps you reminded of the fact that you're on this transitory life, and eventually you're going to meet your Lord. So these are the foundations upon which the religion is built. These are what we call the 5 pillars of Islam. Okay? Moving on to caring for the Muslim patient. Now, the person that you deal with or will deal with who believes in those tenets and follows these things, how would you, or what would you expect, or how would they interact with you on a day-to-day basis? Okay? Perhaps the most obvious of these is modesty and gender interactions. Okay. The best option for a Muslim patient is a same-sex provider. Okay? We'll talk about that. Well, let's read what's on the slide and then explain them. So same-sex provider is optimal. Interactions with opposite sex, physical interactions, well, actually, Prezi doesn't have the fade-in option, so I had each one of those fade in and talk about them. So we're seeing them all at once at the slide, but let's talk about them together. Same-sex provider, because a Muslim person is more comfortable with the same gender in their interaction. Our physical interaction are very limited, meaning that, let's talk about hugging, for example. For a Muslim, I cannot hug someone who is marriageable, basically. Someone that I can legally marry, I cannot hug them or have that physical interaction with them. I hug my wife, obviously, my mother, my sister, my aunts, that's fine. That kind of physical interaction is fine. But physical interaction with an opposite sex that you can marry is limited or prohibited in Islam. Now, for some schools of thought, for example, the Imam, he would not shake a woman's hand. Not because a woman is unclean, or not because a woman is sub-man or whatever, but it's for the teaching of limiting the physical interaction. He takes it to a more modest level, in his opinion, to be on the safer side, and he would limit that interaction. If you've seen me, I don't have that kind of limitation, because the handshake, especially in the American culture, is more of an indication of professionalism. There's nothing to it. It's a quick 1-second handshake. For me, it doesn't connote or connotate anything more than that. But to the Imam, and to some, especially from the Asia Pacific, if you look at a lot of Burmese or a lot of Pakistani, they would not do that unless they're forced into. So it might make them uncomfortable, even the handshake. And it's, again, more of a modesty thing. And it's more, the woman herself, too, will not extend her hand to shake, again, for the modesty reason. So handshaking and hugging, and what, you know, after each one of my children is born, the first thing that the nurse wants to do to me is like, give me a nice big hug, which is the way that we express affection. This is the way that in the United States, we don't consider that as anything out of the norm, because this is how I express my happiness for you. This is how I express that, you know, I really appreciated you. I want to give you this nice big hug. Islamically, though, you're putting that person in an awkward situation. Okay, so a lot of times you'll see the Muslim patient, like when you, for example, the Imam, and you can test it out if you want. If you put out your hand, he'll do this. He'll say thank you, you know, and pleased to meet you, because his focus is more on the intellectual and the spiritual interaction rather than the physical interaction. So that brings us to alone in a room. Again, alone in a room with an opposite sex will make that patient uncomfortable, whether that you're a male patient and you're a female nurse, or a female patient and a male nurse, just because of the whole concept of just the two of them in a room alone together is something that would make them feel uncomfortable. Even in my office, when you come to my office, I have a window, at least, that people can see, but a lot of times I'll ask my student, are you comfortable with the door open or not? And we'll keep it that way. It's, again, more of modesty, more of humbleness, rather than anything else. So same-sex provider, if possible, would be optimal for that patient, especially for the female patient, because we have a dress code for both men and women. Obviously, the most strikingly obvious that you see my wife wearing the headscarf. We see one of our students wearing the headscarf here as well. And that's the most obvious. But for men, too, we have a dress code. You can't wear anything above the knee. I can't expose my chest or my body. I can't wear anything tight or form-fitting And same thing for women, it's the loose dress and covering the head or hair. And that was a direct, actually, verse in the Quran, a direct order on the dress for women. But a woman with a woman does not have to cover up, okay? So when my wife's best friend is at home with us, she doesn't have to cover up in front of her. If you have a person who is in your care, who's already sick and tired and in the hospital, it would be a lot more comfortable for her to have a female nurse or a female physician, then she wouldn't have to cover up. She's not in a, you know, a lot of times we've seen these gowns, they're immodest for anybody really, but they're necessary. So having a same-sex provider would keep that patient more comfortable and will keep the interaction a lot more comfortable as well. And I say if available and if it's not out of the way. If you were in rural Maine where it's only one male OBGYN that we've had, it's too much to find another place or to find a female practitioner, then it's fine because the interaction is medical, the interaction is for the caring of the patient. But again, optimal is same-sex provider, optimal is limiting the physical interaction. And then one thing that really bugged me, and whether you're Muslim or not, a lot of times when you're in the hospital, what we do is, it's like 2 knocks and we storm in the door. I had a lot of physicians that do that. Dr. Spister, no, I'm just kidding. Actually, he does, he knocks and he waits till he hears somebody say, come in or something before he comes in. But in the hospital that I worked at, a lot of times it's knock, knock, enter. You haven't given the person the chance to, you know, whether if it's a female and Dr. Spister is walking in for her to put the headscarf on, or if I'm a male patient and I'm laying there in that gown, for me to, you know, become modest again or cover up again before I do that. So just to be conscientious of the fact that there is that limitation on the physical interaction and limitation on the, or not, I don't want to say limitation, but rather respect that would put your patient more at ease when you care for them, is to be conscientious of that. We're good? Any questions? Yes, sir.
Probably brings up this and others. Give us some examples of things we might say to acknowledge the fact that we'll have to engage in some uncomfortable behavior or examination or something like that before we actually do it. So if I'm, say, stethoscope, I'm listening to the chest. Is there something I might do or say in advance to both acknowledge their concerns and their comfort and make them maybe feel a little more comfortable about what's going to happen?
So the question is there anything in particular that I should say or can say if I'm about to do a physical exam? I'm about to touch them, I'm about to hear their heart rate or listen to their chest or anything like that. And I've had the advantage of being in as a translator in the room with Dr. Spister as he interacted with a couple of Muslim Arabic-speaking patients that don't speak English. And honestly, you do it perfectly. And I'm not saying that just because you're here. He asks with any patient beforehand, I'm about to, you know, listen to your heartbeat. May I? Or may I touch your hand? Or may I feel? And that's just, as simple as that may sound, that's all you need really with any of your patients, but in particular with this patient. No patient is going to look at you and say, get out of the room, I don't want to deal with you. But it would be a lot more comfortable if it was, you know, a female patient, a female physician or a female nurse that was interacting with her. But nobody's going to say, no, get out, no, I don't want to deal with you. It's just more of the comfort level. And asking before you touch or asking before you reach to do your physical exam is the appropriate way to do it, is the more appropriate way to do it.
And you were talking earlier about Eid, to wish them a happy Eid or a merry Eid or a Eid Mubarak. What would be an appropriate greeting for a patient who is either about to participate in Ramadan, or if it's during the month of Ramadan, would be contemplative Ramadan?
Okay, so if someone is about to engage, is there a specific greeting for Ramadan? In the Arabic is Ramadan Kareem, or generous Ramadan, but I wish you a good Ramadan or a blessed Ramadan is also, because it's a month of, again, engaging in a lot of spiritual acts and a lot of prayer. So just wishing them a blessed Ramadan is an appropriate greeting if you choose to acknowledge that as well for them. You're welcome. All right. Dietary considerations. This is probably where you'll see a lot more of that happening. We have a concept called halal food. Halal means permissible, allowed. You know, you're not sinning for eating that. It also means meat and derivatives that have been killed ritually. And this is where, if you remember when we talked about the different, you know, how the cultural interaction or the school of thought from where the person has come from would influence certain practices that are not explicitly stated in the Quran. Meat, Islamically, has to be slaughtered in a particular way, which is you read a quick prayer, and then you use the sharpest knife that you have, a sharp knife, and it's basically slitting the throat. On an anecdotal note, there was some research done that this was the least amount of nerve firing, which indicates least amount of pain for the animal that's being slaughtered. But it may look gruesome, but this slaughtering and draining of the blood makes the meat killed or prepared in the appropriate way. So saying the prayer and slaughtering the animal and draining the blood makes that meat halal, okay, or permissible or allowable. Now, the intricacy, or if you have a Burmese patient, they will not eat any meat, chicken or red meat, that was not slaughtered in this way. For the most part, I'd say almost all of them, and the majority of Pakistanis will not eat it unless it was slaughtered and prepared this way, okay? Someone like me, living in a predominantly non-Muslim country, and there might not be ease of access to this meat, I'm allowed by the Quran to eat meat of the people of the book, basically Christians and Jews, that if they've slaughtered it and they've killed it, I am allowed to eat it. So here's where you'll have the difference where you know, you'll see some patients that will refuse the meat. All seafood is halal, by the way. Anything that comes from the sea is, well, pretty much anything that comes from the sea is edible. There's no ritual way of slaughtering or preparing that meat. But only the red meat and the chicken that has to be killed in that particular way, or venison or whatever, that has to be slaughtered in that spiritual way and prepared in that particular way, that you'll see your Burmese, your Pakistani, a lot of Indians will have to have it prepared that way. Otherwise, they will not eat it. Other things that are not permitted in Islam from a dietary perspective is alcohol. I do not buy it. I do not sell it. I do not have it in my house. I will not come to a party if the main event of the party was alcohol. It is something that's completely and absolutely and explicitly prohibited in Islam. It also, that might trickle down in some medications. What's the magic ingredient of NyQuil? Alcohol. What's the percentage of alcohol in NyQuil?
Less now.
Less now, but it's still a good chunk. Like it used to be 7%, I think, and now it might be around the 5%. But that's what knocks you out at night, really, for the most part. So as a Muslim, I would not buy NyQuil because of the alcohol content in it, but also because there's an alternative that is available that I can use, which is I can use Benadryl if I'm having a hard time sleeping. I can use, you know, dextromethorphan if I need to, a cough suppressant, or I can use my pharmacist if I don't know what it is that I need to take, because they're really friendly and they're really out there to help you. That's not a shameless plug at all. But I would avoid the alcohol, or I would avoid NyQuil just because of the alcohol being in it and because there is an alternative that is available. Okay? Where it gets a little trickier is that I don't eat pork or any pork products. So no swine or swine products. We don't eat gelatin. We don't eat Jello, for example, is made out of gelatin. We don't eat that. Where it comes a little tricky is capsules, and a lot of capsules have gelatin that might be pork derived. Now, there's not an alternative available out there. If it's available orally, for example, Dayquil capsules or Dayquil liquid, I would prefer to go with the Dayquil liquid because it doesn't have the gelatin part in it. I don't think you'll find patients refusing to take a tablet because it might have gelatin in it. I don't think they have that level of knowledge to that point unless you're really in the field. But the alternative out there, if it's available, it's better for that Muslim patient. But you have the excuse, obviously, you're sick. This is the way to deliver the medicine. You're in a situation where you have to take it or need to take it, then you can excuse and you can take it. So pop quiz again. Which of these 4 products can I eat? Top right, Jell-O, nice juicy burger with bacon, Italian sub, or a burger? Burger. This is the one that, she gets the bonus point. So she said it depends on the burger and how it's prepared. Now, we'll get to that point. But first of all, why can I not eat Jell-O? Has gelatin. But fear none, my kids eat Jell-O because there is Jell-O that's available with fish gelatin and beef gelatin. This one, obviously, bacon. That one is all kinds of swine with an Italian sub. This one is the meat. I would eat it. But perhaps a Burmese patient or a Burmese person would ask how it was prepared before they eat it. But how does that influence or impact your care? What do we usually give a patient right when they come out of surgery to eat? Jell-O. So if you have a person who's refusing, a Muslim person or identified themselves as a Muslim person who's refusing the Jell-O, what's the first thought that pops in your mind? Before you knew that they can't eat it because of gelatin.
They're sleepy and not hungry.
They're sleepy, not hungry.
Nauseated.
They're nauseated. I might push some more Zofran. They might, something went wrong with the surgery or something because, I mean, and especially if you get into a patient who cannot speak English very well, not to say, again, not every Muslim is an immigrant. There's a lot of Muslims that were here from more than 200 years. But the point is, if you have a patient who's refusing the Jell-O, but they ascribe to the religion of Islam or they identify themselves as Muslims, it'll give you pause to think about, it might be that because of the gelatin they're not eating it and look for an alternative. Yes?
Why can't you eat pork? That's just the way it is.
Explicitly in the Quran, pork and alcohol are prohibited. Sometimes we get into reasoning, but sometimes the reasoning is not given and it's just a direct order that we take it, we say we believe in, and we follow.
Have you tasted bacon? I mean, it's delicious.
That's my wife who converted to Islam about 10 years ago. That's the one food item she misses is the bacon. She's like, but she went to the turkey bacon, I guess. I don't know if it's the same thing. Delicious or not, the explicit order, and then there are prohibitions on things that might be pleasurable, things that might be, for example, premarital sex, alcohol. There might be some pleasure in engaging in such an act, but it's prohibited again because you're to train yourself living within the paradigm of the religion in order to gain God's pleasure. Is that a question?
You said that there was some gelatin made with fish or
Beef.
beef.
Yeah.
And how would we recognize that on the package? Is it clearly labeled?
It'll say beef gelatin. Some packages will say kosher because Jews as well, they don't eat gelatin or pork, swine gelatin. And we have here locally now, we have 2 halal stores or stores that carry products that are prepared in a halal fashion. One on Hobson Road, State and Hobson, owned by a young Burmese family, very wonderful people, great customer service, have a lot of good products out there. And then there's a store farther down on Lake Avenue owned by a couple of Yemeni brothers that carries also a different variety. So we have access to it here. I have access to halal meat. So my preference a lot of times is to get the halal meat unless I'm in a bind and I can get other chicken or other meat. Yes?
Question, if someone is in the hospital admitted, and they're practicing just eating halal meat for protein, and they need the protein to recuperate correctly, to heal, can family bring in halal meat for them? Or is there a protein supplement like Ensure that they could drink to get their protein?
Thank you. So the question is, if someone is hospitalized and they only eat halal meat, but you're serving them protein, they want a protein source to eat, and obviously halal meat might not be available at the hospital. If the hospital allows outside food to come in, family members would bring it. Any other source of protein, whether it's seafood or whether it's Ensure or something along those lines, yes. I don't think anybody really is, unless they're on a TPN and within the TPN they're getting their nutrients, they're not going to be at a point where they really have to eat meat to get the protein while they're at their acute stay within the hospital. But family can bring it. It's readily available in town. A lot of families, before we had those 2 stores, would bring from Indianapolis or Chicago, and they'll freeze a lot of meat and we'll keep it, and they'll go every couple of months and go stock up on that. So yeah, that's a good question, but usually you can talk to the family and they can have it readily available. We're good? All right, next up, hygiene. And we're almost there. Islam places great emphasis on hygiene in both physical and spiritual terms. We talked about ablution or wudu and washing up for prayer. Other hygiene-related practices is washing with water after urination or defecation. That's a lot of Muslims, practicing Muslims, that's the best way to get clean. I hate to give you this image this late at night, but really using water to clean yourself afterwards is the best way to be clean. So if you have a bedridden patient, having using a bedpan, a beaker of water available to them so that they can clean themselves afterwards would be a nice gesture. Sometimes you go into, actually if you go into our bathrooms, I don't know if you noticed those little water vases sitting next to each toilet. That's for that purpose, for the person to clean themselves. Not vases, what's the word I'm looking for? Pitchers, thank you. So, so you'll have those in bathrooms. Sometimes when you go into a patient's, they're staying in the hospital, they might actually fill up a water bottle and leave it next to the toilet instead of asking you to have something ready for them. They might have that right there just for them to clean themselves. So it might seem simple and basic, but it's something that if it's equipped with for a person who is a practicing Muslim, it would make it a lot more comfortable for them. Other things is, keeping yourself trimmed, armpit, pubic hair, nostrils clean, fingernails trimmed. Really, you won't see it in an acute care setting, but if you're in a long-term care setting or someone who's staying with you for a prolonged period, just offering them simple nail clippers might make them feel better. They're cleaning themselves. They have control over that too. It gives them psychologically a little bit of empowerment that they might be sick enough, but they can still clean themselves or cut their nails and feel better about themselves. Maternity, labor, and delivery. As soon as a child is born, a Muslim father may wish to recite a call to prayer into the baby's ear. So the call to prayer that you heard with each one of my children, I've requested the delivery room, whoever is in the delivery room, to keep the chatter to a minimum. Obviously, they need to communicate. But I would like for the first words for my child to hear is the call to prayer in their ear. Okay? Mom can't do it because she's drugged up. So usually dad walks in and does the prayer into the baby's ear. Circumcision is performed on all male children. Unfortunately, reality is you may see some Muslim girls with female circumcision. This is not an Islamic practice. Let me repeat that. This is not an Islamic practice. This is a practice that we see in Africa. A couple of countries whose names escape me with a predominantly Christian population, they still perform female circumcision. This is a cultural practice that is not part of Islam. For Islam, all males are circumcised, usually circumcised within a couple of days of birth, and unless it's medically necessary to postpone that, that's fine. But eventually they get circumcised. A fetus after the age of 120 days is regarded as a viable baby. And what do I mean by that? And we'll talk about abortion within that as well. So, so hold on for a second. Basically, after 120 days, if the mother has a miscarriage, that fetus is given a name and given a proper burial. Okay? So it comes from the spirit is blown into the baby after 120 days. Okay? So any of these cases, stillbirth or miscarriage or anything, the baby is given a name and given a proper burial. Okay? Now, that does not mean that anyone under 120 days is willy-nilly. Abortion is not allowed in Islam unless it is medically necessary. Okay? What do I mean by that? We're pregnant, we do a genetic testing, find out that my child is going to be born with Down syndrome. I cannot terminate the pregnancy just because I don't want to care for a child with Down syndrome. Okay? But mother's life is at risk. Child is causing that risk, might need into abortion or something like that. Usually you'll end up with the situation, the medical decision. A lot of times they would ask for a scholar's opinion on the particular case, just so that they're more comfortable from a spiritual perspective that they're not committing a sin or a crime. And usually the case is, if there's a danger to the mother, then the abortion could be allowed in that situation. Okay? So it's not abortion just because they're under 120 days. And then there's a suggestion about breastfeeding the children. There's actually a verse in the Quran, up to 2 years if capable, to breastfeed the child. And this strengthens the immune system of the child as well. We've seen some research on that. They're getting the antibodies from the mother. Strengthens the relationship between the child and the mother and all of that. So if capable, and you can do it, breastfeeding up to 2 years of age is highly encouraged Islamically. End-of-life issues, we do not have any elaborate or complicated rituals to be performed at the deathbed. What we have instead is, remember how I said when the child is born, we recite or we do the call to prayer in the child's ear. When someone is dying, if they're capable, you'd see them reciting verses of the Quran that they've memorized, or you'd see them reciting the testimony of faith, just repeating it, because that's kind of the completion of the cycle of life. I entered this life on this faith, I want to exit this life on that faith. If they are unable to, you might see some family members or friends next to them reading some Quran to them. They want them to exit on that as well. Okay? And actually that came in handy at a talk that I gave at Lutheran, end-of-life considerations. And one of the nurses was saying that she likes to play classical music to her patients who are, about to die or in their final phases. And I would say about 99, that's my scientific number, 99.9% of all Muslims would prefer to die listening to the Quran rather than music. You'll see it even with the not so practicing Muslims, that at the moment of death, they want to go out on that good note, I guess. The burial is done as soon as possible after death, sometimes on the same day, unless it's needed or there's some investigation or whatever. But if we can clear the body, and typically what happens is you talk with the funeral home, they bring the body of the deceased from the hospital to the funeral home, and then relatives of the deceased would do cleaning the body and then shrouding it in a simple white cloth, shrouding the person in a simple white cloth. And then we put the body in, typically you would bury and put in the ground, but because of health code here, you have to have them in some sort of a coffin. So really the simplest coffin there is. There's no tombstones, there's no elaborate things to put on the grave of a person, because this is just another transition into your eternal life or your final abode. So there's nothing really in there other than making sure that the body is clean, shrouded, and buried within as simple a coffin as possible. We don't burn the body. We don't do anything else with it other than clean it, put it in the ground, and there's a funeral prayer that happens usually afterwards, and we pray for the deceased. A lot of times, you'd find the child praying for the parent, even for the rest of the child's life. They're praying and asking God for forgiveness for their parent and for themselves and all of that. So it's the deed of a person that continues after they die. Blood and organ donations, we accept blood transfusions and transplants of various human organs. It's acceptable for a Muslim to donate blood and organs as, again, the saving of life is considered of a great virtue. And as long as you keep some level of integrity to the body, so you're not doing a hack job. If you're harvesting organs to save somebody else's life, that's great, but you don't just mutilate the body or do anything to the body. You want to preserve it as intact as possible, or as together as possible. Okay. Now, this is a new slide that I added. I'll take 2 seconds for that one, and I promise you we'll go into the question and answer. Something that I talk to my students about when I teach cultural competence in general. First of all, I hate the word competence, but we use it because in all the healthcare professions, they call it cultural competence. Competence is too lofty of a goal for us to achieve. Unless I live in that culture, I breathe that culture, I would not become fully competent in the practices of that culture. I like cultural awareness, but yet I like cultural humility. Understanding that as a healthcare provider, it's not about me, it's about the patient that I'm serving, and that for me to appreciate and respect their cultural practice will deal for a better trust relationship between me and my patient and better outcomes. So there are 2 models that I want to introduce you to very quickly, and we'll move from there. One is called the LEARN model, which is listen to the patient's perspective, explain and share one's own perspective, your perspective as the healthcare provider and what you're trying to do. Acknowledge the differences and similarities between those perspectives. You know, Dr. Spitzer's example, may I, reach and listen to your lungs? That's listening to the patient's perspective, saying, I don't know if I'm comfortable with a male physician touching me, but he's explaining his perspective that I need to get to listen to your lungs. It's for the better. Acknowledge the difference. Okay, I'm comfortable with it. We've talked about it. Recommend treatment, and then negotiate treatment to get to a mutually agreed upon treatment plan, because anybody can tell you, you can give a person all the reasons that they need to take the medication or to follow this physical therapy or occupational therapy plan or to do whatever, and they will not do it if they're not convinced in it. So reaching a treatment or a mutually agreed upon treatment, and this addresses the differences that you might not see. I gave you a very general perspective of what a Muslim believes in and how your interaction with the Muslim might be. That doesn't mean that every single Muslim or Muslim-sounding name that's going to come your way is a practicing Muslim. There's a lot of times that I get from people, well, Muhammad next, my roommate, we used to go out drinking together. Okay, that's Muhammad's problem. Or not, or John that's walking through your door, white, male, Caucasian John, might be a Muslim John that practices differently. So for us not to superimpose our own expectations from a cultural standpoint on the patient. The other one is called ethnic, which is explanation, asking the patient how they feel about their illness. Treatment, healers, and the part of ethnic is just getting at the healers. Have you sought any advice from healers? And healers could be from herbalists that somebody believes in to, I've been sick and I just asked or I prayed more. So, it gets at that, do you have a different understanding of your disease state, or do you have a different understanding that might be culturally or spiritually or religiously influenced that we need to talk about and address? And then you get to intervention and collaboration. So the idea of this talk and talks similar to this one is not for you to walk out of here saying, I know all the things that I need to know about Muslims and how to interact with my Muslim patient, but for you to acknowledge that they might, by they I mean any other patient, might have a different perception of what their disease state is. It might be influenced by their religious practice, by their cultural practice, and for you to acknowledge that will get to the better care for that patient than just assuming that if I tell them to take this medication for that disease, everything is going to be fine and dandy. So in conclusion, the 5 pillars of Islam, prayer is essential, considerations of opposite gender interactions that we talked about, hygienic practices, and the responsibility eventually of practicing religion is on the individual. Again, think about the individual accountability. And as a result, it is important that healthcare providers discuss religious observances needs with each patient. Okay?